Hi, my name is Mackenzie Hardy. I'm a marketing assistant for UNC Health's Department of Neurosurgery. Today I am interviewing one of our neurosurgery residents, Dr. Randaline Barnett. She is one of our PGY4 residents at UNC. And Dr. Barnett is currently expecting her first baby, a baby girl. And she has kindly agreed to answer some questions about her experience training to be a neurosurgeon while expecting. So Dr. Barnett, let's start with what made you decide to pursue a career in neurosurgery?
So I think it's pretty funny because when I went into medical school, neurosurgery wasn't even on the radar at all. I knew I wanted to be a doctor since I was 5, and I was always interested in surgery, but I came in thinking that I wanted to be an OBGYN. I was pretty set on that. And my first year in med school, when we had neuroscience, I just absolutely fell in love with the brain. I love the anatomy, the pathology, the clinical manifestations that come from that pathology. And I still really want to do surgery. So I thought, well, maybe I can shadow a neurosurgeon and see what this is actually like. And I was really lucky to find some really fabulous mentors that were super encouraging and really facilitated my journey into neurosurgery. And one of them actually let me drill my first burr hole when I was a second year in med school. And that was it. There was no going back after that.
What aspects of your pregnancy, if any, have made your neurosurgery residency training even more challenging than it already is?
I am very much of a planner. I try to plan like every aspect of my life. It usually doesn't always work out, but we try. And my husband and I, like, we really talked about this a lot beforehand because we knew that this was going to be challenging. And one of the other things I was really worried about is just a new thing that's coming up, especially amongst female physicians, is we're all really concerned about infertility issues because it's pretty prevalent amongst women physicians, and it's starting to get some more traction in the media now. We don't know like why that is. Probably because we probably put off having children for a while because of our training. But I wanted to make sure that like I had the opportunity to have a child, and it can be hard to navigate that in residency, but it can be just challenging to be a resident in general. I have a research year coming up starting in June, and we thought that that would be the perfect time for delivery because that way it wouldn't affect my co-resident schedules at all. It would allow me to recover and spend time with my daughter, and so we thought that would be the perfect time, and thankfully it worked out. I think the challenges that I've seen so far is my first trimester, I didn't really expect how difficult it was going to be. I had pretty bad morning sickness, which pretty much lasted all day, every day for about a good 7 or 8 weeks. But my colleagues were like super supportive. I told my attendings and my co-residents very early on in my pregnancy, and they were all like very supportive of me and made accommodations for me. And I did get all the work done that I was doing before. It was a little bit harder, but I just pushed through it. Operating was a little more challenging as well. I started getting some pretty bad hot flashes, and there were some times where I would be on the verge of passing out. And so we just learned from those experiences. I learned that wearing an ice vest was really helpful. I literally had a vest with ice packs in it under my gown when I would operate. And then my attendings would let me sit down in a chair during some cases. And if I needed to take a break to, sit and rest or, get some water, they were like super supportive of all that. So I'm just really thankful that I work with a really great team that took good care of me.
So how do you find balance and time for self-care outside of work while you're in the middle of such a demanding residency program?
So I'll admit the first 2 years of residency, I probably didn't take as good care of myself. It's a pretty tough transition to make from medical school, and I think we all struggle with this to a certain extent, especially because intern year and second year, you're probably spending more hours in the hospital than most of the other residents, especially PGY2 year, because that's when you take most of the in-house neurosurgery call. I think what really helped me was my husband has been such a huge support system for me, and he's been like a true partner in every sense of the word. And I think I've had to lean on him a lot for both emotional support and just having help at home. I didn't have time to do all the normal things I would do at home, like laundry and cooking, and he really stepped up and took care of like all of that for me. I think third year I really made a push to take better care of myself, because we just started thinking about trying to get pregnant later, and I wanted to be healthy and make sure I had a healthy pregnancy. And so I started running every day, that I wasn't on call. That's what I did in medical school, and it was a huge like stress relief method for me. And I think that helped me a lot. It really helped with my happiness at work, outside of work. I still try to maintain that. It's a little harder being pregnant, but we're still trying to stay healthy.
Good. So what would you say to other aspiring female physicians who are interested in pursuing a career in neurosurgery, but also want to have a family?
Oh, I would say totally go for it. I think I live by, I have one life to live, and this is all I have. And I don't want to have any major regrets at the end of my life. I love what I do. I love my job. I love taking care of people through neurosurgery. It's phenomenal, the stuff that we get to do and the relationships that we have with our patients. And I've always wanted to be a mom. I cannot wait to have my daughter. I'm so excited. And I'm really happy that I'm getting to have both of those. And I think it's totally doable. I think, it's hard to be a mom. I think in general, I've really taken to support groups, especially for physician moms, and just hearing their journeys and, issues and concerns that they've had. I've tried to prepare myself for what mom life is going to be like, once she's out of the womb. But I think it's totally doable. I think, it does require some planning, and I think having a good support system is probably the most important thing. And I really found that with my family and my residency program. I consider them part of my family. I definitely spend more time with them than my own family sometimes. But when I went into residency, when I was applying for residency, that was one of the things I really looked at when I was interviewing was I wanted to find somewhere that treated me like a person and not just a worker bee. And I think I really found that at UNC. And I mean, they've been like a huge support for me during all of this. I couldn't be at a better program right now.
And so last question is, as a healthcare provider and an expectant mother, what changes have you made both at home and at work to stay healthy during the coronavirus pandemic?
Yeah, so this has been a crazy situation for all of us. I never ever thought I would be bringing my first child into the world in the middle of a pandemic. Certainly didn't plan for that one. But again, my department has been awesome, because when things started ramping up and we started, to see cases, coming in North Carolina, which thankfully we've done a really good job at flattening our curve here. I talked with my program director and my chairman, and we made the collective decision that since we know that there are, physiologic changes that happen during pregnancy that makes me more susceptible to viral illness, and we don't really know how it's affecting pregnant women right now, but the safest thing would be to have me not be on the inpatient service for now and just work mainly through telemedicine and doing research projects. Because I'm getting ready to start my research year anyway in June. So we thought this would be just a good way to, transition me and make sure I'm staying safe during this period of time. And, I'd really struggled with that decision because I love what I do and I miss operating, I miss taking care of my patients, but I'm also trying to do what's best as a mom. And, my daughter doesn't have a choice in this, and so I have to protect her too. And I'm just really thankful that I have a team that was willing to work with me and make sure that we're staying safe. So right now we're doing most of our work at home through telemedicine. I've helped get our telemedicine program started. We previously weren't seeing patients virtually before, so this is all new for us. And I've been facilitating a lot of those appointments with my attendings. And it's been a really good learning experience for me. I've, gotten to meet a lot of people in our department that do a lot of the behind the scenes work and that I wouldn't have previously met, as a resident. and just seeing like all the roles that different people play in this whole process to allow us to see our patients efficiently. I mean, it's been amazing. And I'm quite confident that I'm going to use this in my practice later on. And then also, having more time for my research endeavors. So that's nice too.
And thank you so much for sharing with us. Thank you, Dr. Barnett, and happy Mother's Day weekend to you and to all the other mothers out there, both in and out of the medical field. And we just really appreciate you taking the time to share about your experience being a mom and, still becoming a neurosurgeon. I think that's really inspiring for the other female physicians out there. So thank you so much.
Thank you.